All right, hello everyone. This is Clinical Informatics with Kenji, and today we'll be talking about cybersecurity in healthcare. This is an introduction video, and we'll be touching on why it is important for us as a clinical informatician and just in general as a physician to understand cybersecurity. All right, let's get into it. So, outline of this video, we'll be touching on how common is cyber attack against healthcare system, what are the consequences of being attacked, and why is healthcare system so vulnerable to cyber attack? This is important because we now handle big data to train machine learning. We always touch on patients' clinical record, but oftentimes we need a lot of data for research and development. And if it's not secure, we will not be able to do research. And AI has made our life more convenient, but it has also made it convenient for the hackers as well. So we need to be able to protect ourselves and protect our patients. A couple case vignettes. During COVID time, healthcare system in the US faced ransom attacks from a group known as UNC 1878. And in Germany, uh, during COVID time, a hospital was attacked by a ransomware, which disrupted emergency service, and the patient had to be moved to another hospital, which took time. So you could imagine how this could lead to a patient's death in an emergent situation. So how common is cyber attack? In 2013 alone, a report found 94% of healthcare system experienced some level of attack. And retrospective study from 2013 to 2017 found about 1,500 incidents of cyber attack and over 150 million patient records being attacked and being affected. So the question comes up, why is healthcare so vulnerable to these cyber attacks? Well, one reason is because there are many entry points for attack. Often, a patient is hooked up to multiple monitors and they go through multiple devices. Uh, and if the hacker is able to access one point, then they have access to all of them. For example, if the patient is on, for example, EKG, and they also get an ultrasound, and that data all goes into EMR. And then the hacker can go into any of these, and let's say it goes into EKG, and then it could transfer around, and then eventually it could reach the data that they want to get from the hospital. Another reason it is vulnerable is because healthcare sector has a lot of connections. Um, the hospital itself, but also insurance companies and government agencies and even vendors. So all of these are interconnected. So if they could hack into one of them, they can possibly access others. So for hackers, it's there's only good things. Uh, and healthcare sector, uh, our budget for cybersecurity is about 4 to 7% versus in other sector like finance and technology, they put 10 to 14% of their budget in cybersecurity. So these lack of investment leads to healthcare system using antiquated legacy systems and will be vulnerable to attack. And another reason why healthcare is so vulnerable is because uh, the survey have found that many leaders in healthcare are not proficient in cybersecurity. And it is very difficult to train people in cybersecurity, um, especially they're already very busy. As a physician, you're already very busy. And on top of that, to be familiar with cybersecurity can be sometimes overwhelming. So attackers see healthcare attacks to be easy and lucrative. So we have a lot of sensitive data, and oftentimes healthcare are willing to pay the ransom quickly because the patient's life is on the line. Um, and we have lesser cybersecurity measures. we don't invest as much in cybersecurity, and it is also difficult to be persecuted when the attack is happening overseas. These are all reasons why healthcare is a bit more vulnerable than other sectors. So in summary, uh, cyber attack against healthcare system is quite common, and healthcare system is vulnerable to cyber attack because we've been lacking investment into cybersecurity. Um, People and leaderships are not as familiar with cybersecurity, and because there are multiple entry points within the hospital and outside of hospital as well, like the insurance and government related connection network with the hospital. And attackers take advantage of the ease of the attack and difficulty being persecuted. And weak cybersecurity system can not only lead to data leaks and cost, but also patient's death. So that is the end of this video. In the next video, I'll talk a little bit more about laws impacting cybersecurity in healthcare. All right, see you in the next video.